So, episode one from Handcrafted Health. What is perimenopause? I get asked this a lot. And so, in the next little while, we'll just go through what it is and what it is not, and the drivers behind it. So, I often get asked in women in their 30s, even, am I going through perimenopause? And the truth is, maybe not yet. Perimenopause is usually the 10 years before menopause. Now, menopause traditionally is around 51, 52, depending on the price of fish. I've had some women who have had menopause as late as 57. And I've had other women who've started their menopausal journey at around 45. So, depending on your genetics, often, and your general good health as to when you might start experiencing menopause. But symptoms can start typically 2 to 12 years before the last menstrual period. And they can vary depending on, again, the genetics. So maybe ask your mum, your older sister, maybe your aunts, whatever, how they experience their transition and menopause. And it also could be, as I said, your general good health. So the healthier we are, usually the longer that we will menstruate. It's not always the case, but that is a good rule of thumb. So initially in perimenopause, your periods don't have to necessarily change. You could still be menstruating regularly, having a regular cycle, and you might be in perimenopause. And it is a gradual process. It isn't a line in the sand. It isn't one day. It is happens sometimes quite subtly. And other times it can be, for some women, it can be quite marked. So, as I said, menopause, we diagnose, if that's the right word, but we go into menopause retrospectively. So, when you have had a period, we have to wait for a year. And if you have no further periods in that year, then we can say you're in menopause. And any time, and I've had many women who've been, 9 months without a period and then they get a period. And then the clock starts again. It's like, you're not there yet. Your body's still had another cycle. It's still thinking about um, menstruating, and so therefore it is not menopause yet, which can be quite disappointing for some women when they get really close. Um, but it is that transition period that we're speaking about. So, as I said, the 2 to 12 maybe years beforehand when some symptoms will start. Traditionally, it's in the 40s, mid 40s, and that's when I start seeing fluctuations in the menstrual cycle. Maybe they're getting much shorter. So, you might have maybe a period every 3 weeks. For some women, it can be every fortnight, which of course is not okay. That puts a huge strain on the body. And so knowing that that's not appropriate and not okay, and certainly something that you can do something about is really important. Other symptoms can be just, heightened mood, perhaps anxiety. I see a lot of that. Women who have never been anxious before and or get really teary or get set off really easily about something that perhaps they wouldn't normally get worried about, and now they're really starting to fire. Um, so mood changes, classically the hot flushes are what is most common for women in this perimenopause and even leading into menopause. And these symptoms, again, do continue into menopause for some people. It again can be a reflection of your general health, but it also might be other drivers, which we'll talk about it in later episodes, because at menopause, or certainly in this perimenopausal place, what we're seeing is this real recalibration of the entire body, and it can be smooth sailing for a few women, but often the majority of women will experience at least one, possibly more symptoms. So what are they? Well, here are just some, if you go online, you can see some of the symptom lists for perimenopause and menopause, and it's just like there's there's hundreds of them almost. And that's because the hormones that we are working with, or that certainly are fluctuating wildly at this time, have so many impacts in so many different body systems. So women will commonly speak to me about anxiety that just comes from nowhere. It's like, I don't know that I'm an anxious person. Or they might be anxious and they find that their anxiety is heightened at this time. So it makes everything worse. Brain fog's another one. It's really, really classic. Or it's like I had the word on the tip of my tongue. What was it? Oh, damn, I can't remember. Um, and it might be just that you're overloaded, or that perhaps, you just genuinely have forgotten something. But if it's happening on a regular basis, then that might be something, that brain fog. It feels like I just can't think anymore. Could be another sign that perimenopause is at play. Mood changes, as I mentioned, and getting irritable around things that wouldn't have necessarily set you off, like small things that don't really bother you normally, and then all of a sudden, bang, it really is a problem. Classically, the sleep is disrupted, and it's often disrupted by the hot flashes, depending on what you want to say. Um, but it's also, this anxiety can mean that your body is in such a heightened state most of the daytime that coming into sleep is not something that your nervous system is set up for. It's still kind of rewired. And so if you don't get good restorative sleep at this time, or pretty much any time, what you'll find is you start to get even more anxious, and even more brain fog and even more mood changes. So it's like this self-fulfilling prophecy. I see women who are incredibly tired but so wired, tired but wired. They cannot calm down, and they can't therefore go to sleep. And then everything continues. Hair thinning, I find a lot of symptoms, the skin changes, the hair might thin, the the meno belly that I haven't got on this slide, but often women will potentially put on a little more weight, particularly around the middle, and have not really changed anything. They may not have changed their exercise habits or their eating habits, and they're just putting on weight. And hair thinning is another one of these. There's a lot of drivers for hair loss, and I do go through those at different times on my website and in blogs and so on. So if you want to know more about any of these, I've actually got some blogs on my website that go into them. And the other thing that I find a lot of women, I've had this joint pain. It's like, oh, geez, I hurt my elbow, or I hurt my knee, and it just tweaks, and it's like, oh, geez, where did that come from? And heart palpitations. Around this time, we go insulin resistant. So estrogen and insulin have this love affair, and so our body glucose, or our glucose levels, and our cholesterol for that matter, are often stabilized not just with food but also with our estrogen levels. And as they decline, then so we find cardiovascular risk increases, and we also start to find this blood glucose dysregulation, and perhaps the onset or the start of type 2 diabetes. So making sure that we are on track is incredibly important to transition this process, or this, it is a normal process. Our bodies will reduce these estrogens and progesterones and hormones as a result of perimenopause and menopause, and that's a completely natural process. And what often happens is there's so much else going on at this time metabolically, internally, and then also externally with the environment and lifestyle and diet and what have you, that we do start to find all of these disruptions. So who's playing around here? Well, estrogen, but interestingly, progesterone. Progesterone's our calming hormone. It works with the neurotransmitters in our brain, GABA, for instance, that is incredibly calming. And with the decline in progesterone, which often happens prior to the declines in estrogen, you start to lose that sense of calm. And that's when the mood issues perhaps start. And it's really, really important at this point to make sure that we've got really good dietary and lifestyle habits in place. Estrogen will almost fall off a cliff. um, Comparatively, men will transition into andropause as well, but their transition is far slower and more gentle. Like they literally don't have the fluctuating cycles, of course, that women do. So when we go into menopause, this estrogen really does drop very rapidly comparatively. And I find a lot of women who have the most difficulty transitioning through perimenopause have had difficulty with their estrogen and progesterone prior. So they've had I always ask about a menstrual history. Like, what's that been like for you? And I've always found that they've had, PCOS or endometriosis or PMS of some kind, or even PMDD. They've had difficulty with their menstrual cycles for years. And then transitioning through perimenopause can be even more difficult, trying to support these hormones and have them um, come down, obviously, but to do so in such a way that is not really violent to the body or not producing all of the symptoms that we're experiencing. The other one we don't think about is testosterone, and we think of it as a boy herb. Sorry, it's a boy hormone, and it is. They've got more than us, but they also have estrogen and progesterone just quietly. But that's another story. We have testosterone. And testosterone can be, or our androgens can be driven by stress and by high carbohydrate diets, to name a few. And then that is also going to be a problem because too much testosterone can also start to create difficulty, particularly around the hair. You often I have women come in and say, yeah, I've got all this hair on my chin and I'm losing it on my hair and head and what's going on? And I'm like, wow, yeah, that's testosterone. So we just need to calm all of the hormones down and just have this hopefully more smooth transition through perimenopause. So 3 starting points. What can you do? What can we do right now? Well, track your symptoms. I mean, find out what's going on. Most women I find have got an app, some kind on their phone that they track their menstrual cycle with, but perhaps you could add in a few more symptoms if you're noticing things that I've mentioned and see how they correlate with the menstrual cycle and see, maybe rate them out of 10 and see if they're getting worse, because that's what needs to happen. You need to make sure that you are if things are getting worse, that you're getting help. Strengthen your foundations. There is unfortunately nothing that can be in the place of good quality sleep, good quality food, movement. You don't have to start running marathons or anything, but you really need to make sure, as I mentioned, stable blood glucose, protein at each meal to stabilize, hopefully, and to really look at the carbohydrate in your diet and make sure that any carbohydrate you're eating is really complex. So whole grains and fruits and vegetables and legumes, if you tolerate those sort of things, and really and I feel like the fun police, but really, really watch alcohol because alcohol is just sugar, pretty much, and it can be hugely disruptive. And I find a lot of women do go to alcohol because it is really calming, and that's what they're after. But it also really hugely disrupts sleep. So it's almost guaranteeing you not to have a good night's sleep. And then, of course, you wake up. And the classic is that most women do the uppers in the morning, so they do loads and loads of caffeine because they're so tired. And then at night, they have to wind down, so they do the alcohol. So they do the uppers and the downers, and that disrupts sleep. And then it's just, this self-fulfilling prophecy. So making sure that you come out of that is really, really important. And stabilizing blood glucose is one of the easiest ways. And making sure that you have protein at each meal is one of the ways to stabilize your blood glucose. And I would say don't navigate this at home. If you're sitting there thinking, oh yeah, this is me, I've got this, I've got some of those things, um, then then see somebody, get support, see a GP, make sure it's nothing more than, is just perimenopause and these changes. But maybe you want to also consult a naturopath or nutritionist, someone like me, who can really make a specialized plan for you. So I hope that's given you some insights as to what might be going on in perimenopause and what might be going on for you. And next week, I'm going to talk about menopausal anxiety and certainly the anxiety in perimenopause as well, and how that's linked and also what we can do about that. So I'm hoping that this was of use to you. If it is, I'd love you to share it with somebody else, and we can start to get the word out there about trying to support getting support through menopause and perimenopause. Thank you.